And what are the three simple daily habits that can help in reversing diabetes?
So type 2 diabetes,
Mhm.
so that's the reversible kind. Definitely we should tell your audience that if they want to know if their diabetes can be reversed or not, because they have to check in with their doctor when they're trying anything, is there's a blood test called a C-peptide blood test. That will tell them my pancreas is making insulin in the right amount or not. Based on that, you know about reversibility. So assuming it's a reversible kind of type 2 diabetes, first most powerful thing is reducing your carbohydrates. This is in the fine print in the American Diabetes Association guidelines. It's just not promoted in the prescription algorithm because then the pharma companies will suffer. But it's there in print. So reducing your carbohydrates. Now, again, my psychological way of handling this in India, particularly, is before I ask you to reduce your carbs, I'm going to make sure you get protein, protein, protein. Protein at breakfast, protein at lunch, protein at dinner. At least 1.2 grams per kilogram body weight, okay, for counting your expected body weight. That's one of the most powerful things. Fixing the sleep, right? So I think screen time, if we are more and more mindful of it, cut it off like 2 hours before you want to be sleepy. Because again, you're telling your brain it's daytime. So it has no preparation for drowsiness. You're not yawning. And strength training.
What advice would you give to someone starting their journey from medication dependence to mindfulness and holistic health?
I like to help people connect to their big why. See, this is only going to, it's a long game. It's not a 2 weeks commitment. It's the entire journey of your life that we're talking about. People struggle sometimes to sustain for the long term. So if it is a push from the outside that your family wants you to change or your doctor wants you to change, it's not going to have much runway. It's
Correct.
going to finish off. So how do we help sustain this for the long term? Can only come when we are in touch with our big why. And the big why, if we can frame it with a what am I working towards? The problem in disease care in diabetes, for example, is sometimes we're running away from some bad thing. I don't want complications. I saw somebody suffer. I don't want that. So it's fear. But we know that cancer pictures on cigarette boxes doesn't stop smoking from happening. Fear is not working as a long-term strategy.
Yes.
Why do smokers quit smoking long term? Is because self-love kicks in. I am worth it. My lungs are worth it. I am done putting this poison. Self-care becomes stronger. Self-love becomes stronger. I'm going towards self-care. I'm not running away from lung cancer anymore because that didn't work long term. So find what is your why that is connected to something you care about, that I want to go towards that. So we ask our patients, what will your life look like when you're done with diabetes? What are the things you would do 20 years from now if diabetes does not run the show? I want to travel. I want to be with my grandkids. I want to grow my business. I want to expand. I want to be there for my family. I have somebody I need to care for. They are not well. I need to be strong for them. Everybody has beautiful reasons why they want to thrive. And it would be a waste if we didn't have them tap into that and we reduced it down to something that, oh, your blood test is not okay. I'm supposed to give you medicine, so you change for my sake. That's such a low value proposition. There's such a beautiful thing sitting inside them,
Yeah.
untapped.
Yeah.